Jennifer Grinnell works as an expert patient advisor in East Anglia. She may look outwardly healthy, but Jennifer suffers from a life-threatening genetic disorder which affects both her lungs and digestive system: cystic fibrosis.
You have CF from birth, but I was diagnosed when I was 2, and it was basically after a severe bout of pneumonia. My parents knew that there was something not quite right. I wasn't putting on weight properly, and I had a really bad cough and caught colds really easily. So it was basically just through their persistence, keep going back to the doctors and saying, you know, something's not right, and eventually I was diagnosed.
1 in 25 people carry the faulty gene which causes cystic fibrosis. When 2 carriers have a child, there is a 1 in 4 chance of the baby inheriting the condition. Cystic fibrosis clogs the lungs with a thick, sticky mucus, making breathing difficult and leaving sufferers' lungs prone to infection and disease.
Well, CF's a progressive disease, so when I was younger I didn't really notice it as much, and then as I started getting into my teenage years I sort of had more chest infections and was in hospital more regularly, having intravenous antibiotics. And now I'm 23, I am noticing kind of how it affects me more on a daily basis. I often get quite breathless, kind of tired throughout the day, and I have to kind of plan my routine to make sure that I'm not going to be too exhausted by the end of the day. And it's basically the breathlessness gets me more than anything, because you really notice it, because it's with you every second of the day.
There has never been a cure for cystic fibrosis, only treatments to slow the inexorable progress of the disease.
This is a couple of days worth of my medication. These are nebulizers that I take to fight infection in my lungs. I've also got enzymes here for absorbing food. I have about 60 tablets a day. I do 8 to 9 nebulizers, which are basically antibiotics and drugs to help open my airways. I have up to 3 inhalers that I do throughout the day. I also do physiotherapy for 30 minutes twice a day, which is basically to clear all the mucus that's built up in my lungs. It's quite a rigorous routine and it's fairly tiring, but it does help me to keep on top of everything, and so it's very important. There are various bugs that people with CF can pick up, and they basically grow in the lungs and they cause infection and lung damage, and you don't really know what bugs you're going to pick up. You just have to be vigilant and treat them as soon as possible.
Damaged lungs can't repair themselves, and so the person with cystic fibrosis, then literally their lungs become more and more degraded until they need a lung transplant. And in fact it's the lung disease caused by cystic fibrosis that's the cause of death of over 90% of people with CF.
Unfortunately, about 3 people die every day waiting for an organ transplant. In order for them to qualify for being put on the lung transplant register, they need to have had a significant reduction in their lung function capacity. This brings up the problem of sort of the actual surgery, the logistics of doing such a complex operation on patients who are becoming quite unwell at this point.
I actually had an older brother with CF who died 4 years ago, waiting on the transplant list. The bond that we had through both of us having CF, I think it was quite a strong bond. And I think losing him has obviously shaped my life profoundly. And I think on a positive thing, I think it's brought me very close to my family, and I think that it's also made me appreciate things, because I know that I've got one life and it might be a lot shorter than other people's, and so it makes you take chances and do things that you might not do.
Now, thanks to gene therapy, a cure may be in sight.
The gene therapy we're looking at is gene replacement therapy. So rather than try and correct the defective gene, what we're trying to do is put a working copy of the gene into the body of someone with cystic fibrosis beside the faulty gene, and therefore that will take over and work on its own. So in the lungs, instead of treating the infections that are caused by the thick sticky mucus that comes about as a result of the CF40CF gene, actually we'll stop the thick sticky mucus being produced in the first place. So someone with cystic fibrosis, just like you or I, will have ordinary mucus in their lungs, which they'll be able to cough up, and it will work properly as the normal body's defence mechanisms. So the effect that will have on their lives will really be quite major.
To see it coming a reality in the near future, it does give you hope, and hope for people that are being born, with CF today as well, that actually their lives might be completely different and they won't have to be doing such a regimented routine, and they'll have more of a normal life, which I think is fantastic.
Research into gene therapy is funded largely by the Cystic Fibrosis Trust, but progress has been delayed because the charity simply can't afford to produce enough medication for the first and second stage trials in one go.
There's a whole range of things, both scientific and cultural and academic, really, that sort of work against a successful conclusion to this. And one must always say that the final thing is the cost. It is very expensive.
The Department of Health has invested $2.5 million in the project over 5 years. But when compared to the $250 million the NHS spent during this period to discourage smoking, it seems a lukewarm commitment.
Our trials, our pilot study and phase 2 study, clinical trial, the product is costing over £7 million. And in fact, there's an extra £2 million of the product has been donated to us from one of the manufacturers. A phase 3 trial will probably cost £100 million, and so we're clearly looking at a pharmaceutical company to take over and run it from there.
Because of delays to the trials, it will be 2015 before a treatment becomes widely available. With a life expectancy of just 35, this means time is running out for those living with the condition today.
It's definitely something that we're going to keep an eye on and would be very keen to see pushed forward, to have a lot more research done on, and certainly clinical trials being done to sort of test whether this would be a viable alternative to transplant and indeed could provide us with a cure for cystic fibrosis.
For children that are born with CF, whereas when I was younger it was kind of a terrible thing, and life expectancy was so young, and there wasn't really there wasn't much hope that you could give to parents. I think it's going to be great to be able to say that you do have CF, but we have this gene therapy, and I can't wait for that day. I think that's going to be brilliant.